The purpose of this video is to apply a dynamic postural assessment. In the dynamic postural assessment, we are going to use the information that has been gathered from the static postural assessment about the ankle, hip, and thorax, three major complexes, three rocks, and how they relate to each other, moving the body using gravity, ground forces, and momentum. As mentioned before, it's another tool in our tools box that we use in order to determine any imbalances or potential weaknesses or pain points for the client. And then we use this information along with other tools as the PDQ, the movement screening, and medical history, together with the client preferences, so that we can prescribe an effective exercise program which is most appropriate for them and for the special needs. If requires, as we said, we refer our client to an AHP if there's something wrong or if there are particular issues that are not or that are out of our scope as PTs. The dynamic postural assessment includes three parts. The first one is the sagittal step, looking at the ankle complex from the front view and the lateral view. The second one is the lateral step or lunge, looking at the hip complex from different viewpoints. And the last one is the transverse step, looking at the thoracic spine from the back view. It is important to note that we are not trying to fix anything. We are purely looking to see if we can facilitate a change. This is our first client, Ofer. Ofer, do you consent to be in this video?
Yes, I do.
Great, thank you. Do you mind taking off
Yes,
your top?
okay.
Are you comfortable with that?
Yeah.
Thank you very much. So the sagittal plan is just a simple step forward, taking your hands by your side.
Should I?
Just a minute, just that. Okay. Let's start with your right foot. Yeah, I will look at you from front view. Great. Yeah, keep on going. Great. Go on. So we can see no excessive pronation of the foot. There is a medial deviation of the knee and hip. We can see that they are coming into the midline of the body. The toes are not going out. Now keep on going, please. Yeah. Looking from the lateral view, we can see that the heel is lifting on the rear foot and slightly lifting on the front foot. The hip, the thorax, and the trunks all rock forward. Thank you, Ofer. Please let's move to the left one. Yep, just exactly the same. No excessive pronation of the foot. There is a medial deviation of the knee and the hip. They move towards the midline of the body. The toes are not going out. Looking from the lateral view, we can see that the heel is lifting on the rear foot and slightly lifting on the front foot. The hip, the thorax, and trunk all rock forward. Thank you, Ofer. Now we will move into the lateral step, focusing on the hip complex. So the lateral, just a minute, please. The lateral step is side step. Could you please take a few of that? Let's start with the right one, while I'm looking you from the front view. What we want to see here is Ofer can take his hip, knee, and toe in a nice alignment. Can his body stop his ankle from taking all the ground force. What we can see is that the knee, hip, and head not stacking over foot. There is no excessive flexion of the trunk, and the lateral border of the stance foot is off the ground. Thank you, Ofer. Let's just swap legs. Do it with the other one. Great. Again, the knee, hip, and head not stacking over the foot. There is no excessive flexion of the trunk, and the lateral border of the stance leg is off the ground. Now we will move into the transverse step, focusing on the thoracic spine. What I want you to do, Ofer, is that. Please turn around, and we will start with your right foot. What we want to see here is what are the relationships between the scapula and the spine. What we can see is there is no movement in the scapula and the spine, probably due to Ofer's kyphosis. There is an excessive rotation of the trunk, the head doesn't follow the hand, and the stance leg doesn't straighten. Thank you, Ofer. Let's move to the left one, please. What we can see is that there is no movement in the scapula and the spine, again, probably due to Ofer kyphosis. There is an excessive rotation of the trunk, the head doesn't follow, and the hand and stance leg doesn't straighten. Thank you, Ofer.